Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. In this video, we will explain the submental approach. The submental approach is used to treat the fractures of interior mandibular body and symphysis. Although these fractures are usually approached and treated intraorally, a submental approach may be indicated. Its indication will depend on the fracture severity and or the presence of a laceration. An advantage of this approach is that the surgeon can easily inspect the mandible's lingual surface to assure optimal reduction. There are no major neurovascular structures in the submental area. The common variations that can be used are: A is following the curvature of the interior mandible, B is that is hidden in the submental skin crease. According to the anatomy and surgical preferences, both techniques offer adequate access to the submental region. The use of a solution containing vasoconstrictors ensures hemostasis at the surgical site. The two options currently available are the use of a local anesthetic or a physiologic solution with vasoconstrictor alone. Incise the skin along the selected path, carry the incision through the skin and subcutaneous tissues to the platysma muscle. The muscle must be divided in the midline. There may be a natural separation of the muscle in the midline. Here you can see. Additionally, the platysma muscle can become very thin in this region. Dissection is carried out to the inferior border of the mandible. The periosteum is incised sharply and the flap is elevated to expose the interior surface of the symphysis. The wound is closed in layers to realign the anatomic structures and to eliminate dead space. The periosteum and platysma muscle should be closed in different layers. A variety of skin closure techniques are available according to surgical preference. The submental incision can be extended laterally to encompass both the right and left mandibular body. The entire lateral surface of the mandible is degloved in the same way as in the submandibular approach. This may be necessary in complex fractures such as comminuted atrophic and severe bilateral fractures. An extension of the incision parallel to the inferior border is shown in this illustration as the approach is explained. To approach complex mandibular fractures, the surgeon essentially combines a right and left submandibular incision with a submental one. The inferior border of the mandible is marked along the planed skin incisions. These larger incisions are sometimes referred to as apron incision. Clinical image of an exposed edentulous atrophic fracture mandible. The wound is closed in layers to realign the anatomic structures and eliminate dead space. A variety of skin closure techniques are available based on surgical preference. A drain may be used if necessary. Thank you. Have a nice time.